Morning, ladies and gentlemen. Myself, Dr. Tiwari. I am consultant anesthesiologist and intensivist at Mediforte Hospital, TC. I have been practicing obstetric anesthesia for the last 30 years. And why I am talking about obstetric anesthesia, in particular about labor anesthesia, because this is one of the most painful conditions for a lady who is undergoing to deliver normally. If you take out the pain score when a lady goes into labor, at McGill's score it is at the highest level of pain. And this particular pain is so severe that at the height of pain even episiotomy is done to deliver a lady and she does not realize the pain of delivery. So this has been a huge concern, how to reduce the pain, how to reduce the anxiety, and how to reduce the painful effects, what the baby is undergoing or what the maternal humoral changes are going through this pain, to minimize the effects on baby. Because the baby, when you are having a severe pain, goes into hypoxic changes because of the reduced blood circulations, because of the increased catecholamines. So it has been a great concern, and how it has been relieved in different countries, in different cultures, in tribal years, through different modalities. It starts from general counseling a person that don't worry, things will be fine, just bear down, to a level of acupuncture, what is practiced in China, and then this medicinal aspect of labor anesthesia came in practice. They started with opioids, pethidine is still a choice. Then newer generations of opioids like fentanyl, sufentanil, because of their ultra short action, but they have side effects. They can reduce the breathing efforts of a newborn when they are going into the fetal circulation. Then certain medicines and certain volatiles also were practiced. Like one of them was Intonox, where nitrous and oxygen 50% were used to relieve the pain and anxiety. Followed by sevoflurane was also used because of its rapid relief from the body. But it was found to cause patients produce some stages of anesthesia, and patient may become flaccid or may become stuporous in planes of anesthesia. So how it can be reduced? The newer technique of epidural analgesia was introduced. When it was introduced, it had its own side effects. It was criticized a lot. It cannot be good because the patients may not deliver, can have obstructed delivery. Then it was realized if we reduce the dosage of local anesthetics, which we use in epidural anesthesia, the patient can have a walking delivery and it can be given at any stage of labor. And further, it was advised that patient can demand for it. Why patient can demand for it? When the patient feels the labor pain and the gynecologist confirms that lady is going into labor, then it's best to put an epidural catheter and use local anesthetic, and you can minimize the pain. But how to use and which drug to use, epidural can be done by anesthesiologist who is practicing it. The drugs are bupivacaine or ribobupivacaine or maybe ropivacaine, and it is given in a very minimal dose. I will give you the example. Like suppose bupivacaine, what we use for anesthesia, what we use for epidural anesthesia is 0.5%. But when we use it for epidural anesthesia, we give a strength of 0.0625. So you can imagine 8 times the drug is diluted, and it will only affect the pain carrying fibers. So the labor is still in progress, the lady can bear down, but there is no pain. And it's a miracle to ladies. And they have always appreciated it. Thank God it was such a painless delivery of my baby, and I can see. So there is very minimal side effects. There is advantage of patient can be taken into cesarean in case it's not progressing well. No additional injections. The same epidural can be topped up with a normal dose of epidural anesthesia, and the baby will not be having any side effects like fetal hypoxia, and further it's a boon to the mankind and a help by an anesthesiologist to an expectant mother Thank you very much.